there is your question. So if you have read and understood, considering a surgical anatomy station, kindly tell me what you understand by the term mediastinum.
What number? What's the number?
Mediastinum. Can you define the term mediastinum?
Mediastinum. It's the area has the sternum and the between the it has the heart. It has the pericardium and
Space between
pelvic-
sternum and on the back it's
the back of the vertebra.
the vertebral column, right? So space between sternum front and the back is vertebral column.
Back of
Right.
vertebra. Yes.
How do you divide mediastinum? Is there any yes?
Superior and inferior by the line bisternal angle and the
Yes.
T4 T5 transverse.
Yes.
And the inferior part it is divided from anterior, middle, and inferior and posterior.
So superior, anterior, middle, and posterior. All right.
Yes.
Can you please tell me the boundaries of posterior mediastinum?
Posterior mediastinum, it's pericardium.
Yes.
And from anterior and vertebra from posterior and from inferior diaphragm and from superior it has a transverse line between the sternal angle and T4 and T5
Very
vertebra.
good. Can you please tell me the contents of the posterior mediastinum?
Yes, it has esophagus. It
Yes.
has aorta.
Descending aorta, yes.
And it has the Azygos vein, vagus nerve, and also the sympathetic trunk.
Yes. Thoracic duct and azygos vein.
Thoracic duct, yes.
Can you identify any of the structures that you have mentioned me? What is
Yes.
this arrow, please?
Sympathetic trunk.
Yes. If you can identify this other arrow, what is one?
This is Azygos vein.
All right, good. What is this? 3, please.
Vagus.
All right, okay. From here, which part or what are the contents of the mediastinum or which parts of the mediastinum can you see or can you identify?
I can identify the anterior part. Okay.
Anterior
the
mediastinum, yes. Middle mediastinum.
Middle and posterior mediastinum.
Yes. And what part
Superior.
of superior mediastinum
Superior,
can you
yes.
see? Yes.
Yes.
All right, good. What is this 15? Can you please identify?
15, it's pulmonary artery.
Okay. If you can identify number 9.
Number 9 is the pericardium of right atrium, right ventricle, sorry.
All right. Can you please tell me if we can come back to this first image? What are you looking at?
I'm looking to the anterior chest wall.
Yes, through the anterior
cavity.
chest wall. Yes, into the thoracic cavity. So what are the organs that you can identify? Which organs?
The lung, the heart,
yes. Heart and
diaphragm, liver.
Okay, and this one?
Pericardium or heart.
Okay, good. Anything here?
Spleen.
All right. If we come back to lungs, can you tell me if you can identify and tell me the surface anatomy of the lung?
The anterior surface.
Surface anatomy as a whole?
Yes, the superior surface. It's
Yes.
from the middle, the point from clavicle and the sternum, 3 cm above the middle third of the clavicle.
Yes.
And the posterior, it's from 5 to 6 cervical to the 6 costal intercostal space, and in posterior it will be 5 costal space, and it has lateral side it will be 4 costal space.
That's true. Okay, we'll come back to that. Can you please tell me, right, what are the structures that pass through the hilum of the lung?
The pulmonary artery, pulmonary vein, and the bronchus, bronchial artery, and bronchial lymph node.
Okay. How many bronchopulmonary segments there are in each lungs?
In the left it will be 9, in the right it will be 10.
Okay, can you please quickly tell me the anterior relation of the anterior nerve relation of the root of the lungs?
The right it will be has a phrenic nerve and azygos vein, and the left it has aorta and phrenic too.
Okay, you have to listen very carefully. I asked for nerve relations. All right. Okay, we are moving on. If you can identify this structure, what are you looking at?
The heart.
Yes, please. Can you identify the structures which are circled? One, please.
Anterior cusp of tricuspid, and 5 chorda tendineae,
Yes.
2 papillary muscle,
7.
right atrium, 9
Nine.
right auricle.
Okay. What is this tortuous? If you can
It's
identify this.
it's marginal artery.
In this diagram, if you can identify the right atrium, please.
Right atrium, it will be number 7.
Okay, above there, right. Can you tell me what are the functions of chorda tendineae?
Chorda tendineae, it has the tense function of the valve and prevent prolapse of the valve. It
Yes.
has to provide the power of the valve to connect with papillary muscle, and has tense power for the valve.
If you can identify ascending thoracic aorta for me, please. In
Ascending
this diagram.
thoracic
Aorta or ascending aorta.
Ascending aorta, it will be number 3. On
It's
the in the
3.
right.
Yes, it's 3. Good. If you can sorry, in this one, if you can please identify number 1.
Azygos.
Yes. Yeah, this is number 1, azygos. Can you please tell me what are the tributaries of azygos vein?
Tributary of azygos, it will be intervertebral, and it has hemiazygos. It has it will give to
Pericardial, mediastinal, yes, and intercostal veins, ossifical,
intercostal,
bronchial, and lower right posterior. Good.
okay.
Yes. All right. One last question. If we can move here in this image, can you would you be able to identify which cusp is this?
This is the anterior of tricusp.
A tricuspid. Which one?
Anterior.
Is it
anterior
which valve is it?
Anterior wall.
Is there any anterior valve? So there is pulmonary valve, there is aortic valve, there is tricuspid valve, and how many valves are there?
You mean cusp? It's three. Three
Yes,
cusp.
I want to know the valves. Pulmonary valve has how many cusps? And which can you see any valve here? In this
Yes,
left-hand side, you mean?
anterior wall.
Anterior wall,
Yes.
anterior cusp of the tricuspid valve, you can see. That is
Oh.
number one.
Okay, anterior wall of tricuspid valve.
Anterior cusp of the tricuspid valve.
And okay.
Okay, because each valves have several 2 or 3 cusps, right? And those cusps are named anterior or posterior accordingly. So if we can come to pulmonary valve, can you tell me how many cusps pulmonary valve has?
3.
Yes, good. Yes, good. Thank you. And